Welcome back to the NExT Appraisal Tool modules. This module provides an overview of using a table to summarize evidence across studies and considerations when making recommendations for practice. To stay organized and make synthesis across studies easier, you can develop a table or matrix of studies that answers your PICO question. The column headers indicate the key information extracted from each study, such as the study purpose, design, sample, results. Below the column headers, each row of a table represents one study. Tailor a table to best meet your needs by creating different column headers. For example, whether your articles test an intervention will determine if you choose to have an intervention column header. The table is intended to help you be more efficient as you compare across studies. Be clear and concise to capture just the essential information. You want just enough information in your table so you do not need to continually go back and read the full article. Minimize the amount of text in the table. Avoid complete sentences. Use abbreviations and acronyms. Create a legendary key so you remember over time and can share with others. To make comparisons easier, enter the information in each row the same order. For example, in the sample column, you could always start with the total sample size, and then the next line would be the sample size for each study group. Use reverse chronology, with the first study row being the most recently published study, and the last row of the table would be the oldest study. Science is expected to build on itself, and you should see progress across time. Researchers learn from the previous studies and address major limitations when planning their own work. Thus, more recent studies are expected to have more rigorous methods, and therefore findings are expected to be more credible. Overall, make it a user-friendly table to allow you to easily organize information that answers your PICO. Lastly, the only studies you should put in this table are the ones that you know will answer your PICO. Here's a template that you can revise as needed to best help you answer your PICO. The design column could also include a brief description of the intervention. Here is an excerpt from published review of the literature by Lee and colleagues that examine the relationships between safety culture and patient safety and quality of care outcomes in hospital settings. Assessment of the quality of studies is indicated by the column on the left, labeled Sackett's. After summarizing the evidence across studies, you need to develop recommendations for practice. Considerations include the level. The higher the better. Level 1 and 2 are preferred for making practice changes, and as you move down the pyramid of evidence, the greater the caution needed. If only observational studies are available, a small pilot test may be warranted, or no change in practice may be the most appropriate recommendation. Another consideration is quality. Reflect on the number of times you were able to answer yes to the critique questions across studies. If the weight of the evidence is towards yes, then the higher the quality and the stronger the evidence for a practice change. Quantity and consistency of results across studies are also important considerations. The number of studies needed to determine whether a practice change is supported will vary. There's no magic number. It depends on the level and the quality. Your clinical expertise, your patient's values and preferences, and the resources available at your workplace will also be factors you need to take into account when developing your recommendations. Overall, use a conservative approach. Use caution if the evidence is not convincing. Rather than implement a change based on inconsistent or weak evidence, maybe explore partnering with a researcher to conduct a study to fill the gap in evidence. While there are other resources, the Johns Hopkins Nursing Center for Evidence-Based Practice at Johns Hopkins University offers an excellent set of tools to assist clinicians with critical appraisal, synthesis, and developing recommendations. Congratulations! You successfully completed this module. You may return to the main menu or continue to other appraisal modules in the NExT EVP course.